How are you feeling? How are you doing?
Good. Been feeling a lot better than when I last was here, so I think I'm doing a lot better.
Okay, great. So at today's appointment, I was hoping maybe we could discuss a little bit about your smoking use.
Okay.
Do you think that would be okay if we talked about that?
Yeah, that's okay.
Okay. Great. So I see that you've recently been diagnosed with COPD. Could you tell me a little bit more about that?
Yeah, I came into the doctor a couple weeks ago, and I'd had like shortness of breath, and especially when I exercised, I'd get really tired easily, and it was hard for me to breathe. So I came into the doctor, and he told me that I have COPD. So.
Okay. And have you been having any other types of health problems that you've been noticing?
Not really. I mean, I've been having trouble sleeping sometimes, and I feel like I've been coughing a lot more lately, and then I have had a few like sinus infections in the last couple of weeks, or months, but I always get them treated and they go away, so it's not that big of a deal. So.
Okay. And has your doctor given you anything to treat the coughing or troubles breathing?
I have an inhaler that he gave me, and I do 2 puffs twice a day, and then if I exercise and I'm having trouble breathing, that's whenever I use it too. So he gave me that.
So when I was hearing some of the other issues you've been having, those kind of correspond with the COPD as well as health problems that can arise from smoking. So I am a little bit concerned about the way smoking is affecting your health.
Okay.
So if you wouldn't mind, if it's okay with you, I'd like to maybe talk about that some more and possibly give you some advice.
Sure, that'd be fine.
Okay. So smoking does have the potential to cause different types of cancers, including throat cancer or lung cancer. If you were to ever want to have kids, I don't know if that's something you want in your future, but it can affect your fertility. It can also cause problems with the fetus, and of course it can affect your lungs and difficulty breathing with your COPD.
Yeah.
And I know that your father passed away. How did he pass away?
He passed away from lung cancer, and he smoked a lot like me. He passed away whenever he was pretty young. He was only 66, so it was hard on my family to see him struggle with that. And then we all took care of him and stayed with him until he did pass away, so it was tough to see that.
Okay. So. Yeah, I completely understand that. That's tough to go through.
Yeah.
So right now, on a scale from 1 to 10, 10 being completely ready and 1 being not ready at all, how ready would you say that you are to stop smoking?
Probably like a 1 or a 2,
okay.
I guess.
And why not like a 3?
I guess just because I feel like smoking really helps me with my depression, and when I get anxious, it really calms me down. And I went through a lot with my depression, and I feel like if I wasn't able to smoke, it would maybe come back a little bit. And it was a really hard time for me, so I wouldn't want that to happen. So
I understand. And how many packs a day do you smoke?
I've smoked probably 2 packs a day.
Okay. I personally just want to say that I have seen you do so well recovering from your depression, and I think you're doing great and being happy, and I think that you would be just fine if you were to stop smoking and being happy. So I have the utmost confidence in you. So tell me a little bit, I heard you say some of those pros to smoking about how it helps you cope with your depression and anxiety. What do you think some cons would be?
Well, I do have a niece who I'm not really allowed to be around if I'm smoking. My brother really doesn't like whenever I smoke, and he's afraid that my niece will like pick up on my habits if she sees me doing it, and just like the secondhand smoke. He knows that it's dangerous for her, and I don't really like to, or I don't want to put her at danger, so I'd like to be able to spend more time with her. And then I know my mom doesn't like it either, and she makes comments when she comes over that like my house and my clothes smell. And then obviously my dad passed away from it, so those are probably some not so good things about it. So.
Okay, yeah, those are all definitely cons that I think might make you consider possibly some changes. So now that we've discussed the pros and the cons, how would you rate your readiness to change on that scale from 1 to 10?
I guess maybe like a 5 or a 6 now.
Okay, wow. So that's definitely a change now that we've talked about that.
Yeah.
So now that you are a little bit maybe considering the option of cutting back, would you consider stopping smoking or making a plan to cut down?
Yeah, I definitely think, I think it would be hard right now for me to totally quit, but I really think that I could probably cut back and then maybe see how that goes and eventually quit, so.
Okay, so let's start with a couple suggestions. Obviously, well, to start off, have you ever tried quitting in the past?
Yeah, I did before, and I was able to go like 3 days one time without, and then I get back into it, and then I'll like try to quit again. But I really think that where I struggle the most is where like I'm at work and people are taking a smoke break, or like I'll go out to bars with friends on the weekends and they'll be smoking, or people at the bar will be smoking, and I can't do it, and that's what's really hard for me. So.
Okay, so what techniques did you use before whenever you tried to stop?
I mean, I would, like when I had the urge to smoke, I would sometimes like call my mom because she knew that I was trying to quit, but that's hard because she's not always available. And I also tried, if I had the urge to like just go outside and take a walk or like do some exercise, but in the end I always came back to smoking again, so. Okay,
those are actually really good techniques to use. I think we could definitely incorporate those along with some other ones, including you could remove the tobacco products from your house completely if you wanted to quit altogether. It's also good to tell the people around you that you're working on cutting back, including your family, again, like your mom and your brother, and your friends who maybe do smoke, just so that maybe they don't smoke around you and give you that temptation.
Okay.
Also, whenever you're out with friends at bars where they're smoking, that could be a problem. So what ways do you think you could?
I mean, I guess we could just go to bars that don't allow smoking, so that it won't be a trigger. And then just letting my friends know too that I'm trying to quit, so maybe they could not smoke when we go out.
Yeah,
so.
And then changing your schedule is also a really good idea. Say it's your break at work. Instead of going to your smoke break, you could go to a coffee shop down the street or out to lunch with friends instead.
That's a good idea.
And then possibly, just like you said, avoiding some triggers and things like that. So do you think you'd be willing to come back for a follow-up in about a week or two to see how you're doing?
Yeah,
okay,
absolutely.
Sounds great. Do you have any questions for me?
Nope, not today.
All right, good luck, and it was nice seeing you.
Thank you.